Small Cemetery Within by Hakan Onder, MD. Every physician carries within himself a small cemetery, where from time to time he goes to pray. René Lariche. For years, I kept this sentence in the margins of my notebooks and on the first slides of lectures, admiring it as a beautifully crafted line rather than recognizing it as a description of my own life in medicine. I would quote it at conferences, nod when colleagues smiled in recognition, and then return to clinic to focus on tumor boards, laboratory values, and treatment protocols. Only after several years in medical oncology did I realize that a similar cemetery had been forming quietly inside me, and that it had begun to shape how I entered each patient's room and how I left the hospital each evening. One evening, I met a 32-year-old teacher with metastatic cervical cancer. She arrived with her husband and a stack of folders almost as tall as she was. Her first question was not about prognosis or treatment options. Instead, she asked, "Will I have enough time to finish the school year?" I explained lines of therapy, schedules, and potential side effects. I spoke about response rates and median survival, but none of these terms contained her classroom or the faces of her students. At the end of the visit, she read the chemotherapy consent form carefully, then looked up and said, "So we will try, and if it doesn't work, at least we know we tried with our eyes open." That sentence stayed with me long after I'd forgotten the exact doses and timing of the regimen I prescribed. For a time, her scans improved. She brought stories from school to the infusion unit. The child who drew her with a superhero cape, and the parents who kept asking whether she was really okay. We celebrated small radiologic changes as if they were assurances, although we both knew they were not. Eventually, the reports changed tone. New lesions appeared, and words such as progression and limited options entered our conversations. Her handwriting on the symptom sheets became smaller and less steady. We spent less time talking about medications and more time talking about what she wanted her students to remember. One day she asked, almost casually, "When you write about me later, will it just be numbers?" I answered with the only honesty I had. "Well, in the file, yes, but not in the quiet place where I keep the patients I cannot forget. There you remain more than numbers." On the day she died, I was in the same hospital, but not in her room. I was upstairs obtaining consent from another patient when a nurse called and said simply, "She has passed." I signed the death certificate, dictated a brief summary, and went back to clinic. Oncology demands that kind of forward momentum. The schedule leaves little room to stop. Yet that evening, driving home, I realized that this 32-year-old teacher had taken her place in the small cemetery Lariche described. She was no longer just deceased due to disease progression. She had become part of the inner landscape that would accompany every future conversation with patients and families facing advanced disease. Our professional lexicon makes these transitions appear deceptively orderly. We say disease progression instead of dying, and limited response instead of this isn't working anymore. These terms are precise and often necessary, but they also create a distance that is easy to overlook. In conferences, we discuss hazard ratios and Kaplan-Meier curves, and how many patients were censored at last follow-up. Each downward step on a survival plot represents a person whose absence is now felt at a family table, yet nothing in the figure or table reflects that absence. Within these formal descriptions lies a disciplined silence. It appears after we say, "There's no further curative treatment," when the room becomes very quiet as families search our faces for one more sentence of hope. It appears in the corridor after a code has been stopped as everyone walks away at slightly different speeds. It appears late in the evening when the infusion chairs are empty and the printer is already generating the list of patients for the following day. This silence does not mean that we have failed to communicate. It's the place where our professional roles and private emotions meet and do not quite align. Working in a public hospital in Turkey, I see how systemic constraints deepen this tension. Clinic days are crowded and visits short. Some families travel long distances with limited resources, hoping that the university hospital will provide answers that smaller centers could not. When I have nothing new to offer, I confront not only the limits of medicine, but also the accumulated weight of social and economic inequities that no protocol can correct. These, too, leave their marks in the internal cemetery. Yet alongside loss, there are moments of unexpected grace. A father, after hearing that his daughter will not recover, says, "Thank you for walking with us this far." A widow returns months later with a box of homemade sweets, explaining, "This ward was where he felt most respected." A young man with lung cancer jokes with the nurses about the hospital food even as his strength fades. Such gestures do not change survival statistics, but they transform the emotional landscape of the day and remind me that presence can be as important as efficacy. They also add color and texture to that inner cemetery, turning it from a place of only loss into a place of meaning. Over time, I've come to see Larisha's cemetery not as a burden, but as a kind of school. Each patient has taught me something. The consequences of delaying hard conversations, the power of sharing silence without reaching for another drug, and the importance of acknowledging uncertainty rather than offering polished but hollow reassurances. These lessons never appear in continuing education credits, yet they shape every new encounter more than any guideline update. At the end of most days, I perform a small ritual. Before leaving the hospital, I hang my white coat on a hook by the office door and allow myself a brief moment of reflection. During that pause, I think of one patient from that day and one from the past. Sometimes that same 32-year-old teacher, and sometimes another whose story has quietly stayed with me. I do not recite a formal prayer, but for a moment, the usual clinical vocabulary falls silent, and their names are present. Perhaps this is what Larisha intended. Not a cemetery of defeat, but a place of remembrance that keeps us from becoming mere technicians of protocol and helps us remain, even at the busiest moments, not only clinicians managing treatment plans, but also witnesses, accompanying others through fragile times.
Welcome back to JCO's Cancer Stories, The Art of Oncology. This ASCO podcast features intimate narratives and perspectives from authors exploring their experiences in oncology. I'm your host, Mikkael Sekeres. I'm professor of medicine and chief of the Division of Hematology at the Sylvester Comprehensive Cancer Center, University of Miami. What a joy it is to have joining us today Dr. Hakan Onder, who is a medical oncologist at the University of Health Sciences, Antalya Training and Research Hospital in Turkey, to discuss his essay, The Small Cemetery Within. Hakan, thank you so much for submitting your article and for joining us today. Hakan and I have agreed to address each other by first names. So I wonder if we could start off by a question I love to ask people who are on the podcast the first time they're here. Can you tell us about yourself? Where are you from? And could you walk us through your career to this point?
Thank you very much for having me. It's a real pleasure to be here, and thank you for opportunity to talk about this essay. I am really looking forward to our conversation today. I am a medical oncologist in Turkey, in Antalya Education and Training Hospital. Before I completed my medical training and later specialist in medical oncology, currently I work at Antalya Education and Research Hospital, where I care for patients with a wide range of cancer. Most of my professional life has been devoted to clinical practice, patients care, and academic work. Over the years, I have become increasingly interested not on the science of oncology, but also in the human experience of illness. And I think that interest is what eventually led me to writing.
That's wonderful. Thank you for sharing that. You practice in Turkey. What is your specialty within oncology, or are you a general oncologist? And can you tell us about what's a typical work week like for you?
First, I am in internal medicine, and then do the exam, and then we will fellowship for medical oncologist. I will describe myself a general medical oncologist. In our practice, we care for patients with different type of cancer, included breast cancer, lung cancer, gastrointestinal cancer, and others. A typical week is usually very busy. Most of my time is spent in the outpatients clinic, seeing patients, discussing treatment options, reviewing scans, and managing ongoing therapies. We also participate in multidisciplinary tumor boards, academic activities, and research whenever possible. Working in public hospital, the pace can be quite intense, and clinic days are often very full. But at the same time, it gives us opportunity to care for a very diverse patients populations, which is the both challenging and rewarding.
When you say you practice in the outpatient setting, how many days per week are you seeing patients in the outpatient setting?
Usually 4 to 5 days per week. Most of those days are spent in the outpatients clinic. Seeing patients throughout the day, the exact schedule can vary from week to week because we also have tumor boards, academic meetings, and inpatients consultations. Generally, the majority of my clinic time is devoted to outpatients care.
Great, great. I'm curious, when did you start writing narrative essays like this?
Well, I never really planned to become a writer.
I don't think any of us do.
Writing developed gradually. During my years in oncology, over time, I realized that some patients and some conversations stayed with me long after I left the hospital. Sometimes it was a question, sometimes a particular moment, and sometimes a single sentences that I could not forget. I found myself reflecting on those experiences, and writing became a natural way to make sense of them. So it wasn't decision I made at one specific moment. It was something that developed slowly alongside my work as an oncologist.
I love how you say that writing is a way to make sense of that, right? It's where we're often handed chaos in oncology, and every single day we see something that doesn't make any sense. And writing allows us the time to sit down and reflect on that and try to organize it, doesn't it?
I think that's exactly right. In oncology, we deal with a great deal of uncertainty. And sometimes, it's situation and that are difficult to fully understand. As a physicians, we try organize things through diagnosis, treatment plan, and clinical decisions. But many experiences resist that kind of structure. Writing gives me an opportunity to slow down, reflect, and think about what those experiences actually means. So for me, writing is not really about finding answers. It is more about understanding that questions a little more deeply.
You start this essay with a beautiful quote from René Lariche, and you say, "Every physician carries within himself or herself a small cemetery where from time to time he or she goes to pray." It's a fascinating quote because it alludes to both the death of our patients. It's a cemetery we're visiting after all, and it brings religion into the practice of medicine. And we don't often bring religion into the practice of medicine. It's a cemetery where we go to pray. What does this quote, which I know is meaningful to you, what does it mean to you?
Over the course of career, we accumulate memories of patients who remain with us, not only because they died, but because they changed us in some way. And for me, the cemetery in that quote is really a place of memory and remembers. As for the word pray, I don't interpret it in a strictly religious sense. I think it speaks more reflection, humility, and respect. Is that quiet moment when we remember the people who entrusted us with their care. So for me, The quote is really about acknowledging that our patients continue to shape us long after they are gone.
Beautifully said. I love how you expand the word prayer beyond religion to reflection and just a moment to stop and think about our patients. How do you think that your patients have changed you?
I think my patients have changed me in many ways. They have taught me medicine, but perhaps more importantly, they have taught me humility. As oncologists, we often focus on treatments, outcomes and decisions, but patients remind us that illness is lived by a person, not by a diagnosis. I have met patients who face extraordinary circumstances with remarkable courage and dignity. And many of them taught me that strength is not always what we imagine it to be. Sometimes strength means simply continuing, despite uncertainty. So I think my patients have made me a more reflective physician and hopefully a more compassionate human being.
I love some of the words you've chosen for that. Things like humility, things like compassion, and a reminder of the humanity behind the orders that we write and the descriptions of disease that we read in a textbook. You discuss words in your essay to describe refractory cancer like progressive and limited options. Why do you think we do that? Why do we back into difficult conversations with our patients and use these euphemisms for a period of time in our patients' lives when they may need to hear that things aren't going so well?
I don't think physicians use those words because we want to avoid honesty. I think often we use them because these conversations are emotionally difficult for everyone involved. Terms like progression, treatment failure, or limited options are medically precious, but they can sometimes create a little distance, and perhaps that distance protects physicians as well. Because behind those words, we understand what they often mean. They may mean lost time, lost opportunities, and sometimes approaching mortality. But I also think patients deserve honesty, delivered with compassion. The challenge is not simply choosing the right words. The challenge is learning how to be truthful while still remaining human. And I think that balance is one of the most difficult part of oncology.
It's such an interesting perspective that you bring, Hakan, when you talk about how we're not just protecting patients, we're protecting ourselves. And the notion that we're not just thinking about the immediate moment of the bad news and the cancer, but we're thinking about a patient's entire life and what potentially they may be losing when cancer gets worse. In your piece, you have a beautiful quote about your patient. You write, "One day she asked, almost casually, 'When you write about me later, will it just be numbers?' I answered with the only honesty I had. In the file, yes, but not in the quiet place where I keep the patients I cannot forget. There, you remain more than numbers." It absolutely a gorgeous quote and an incredible interaction you had with this patient, Hakan. What is it about her that placed her in the category of people you can't forget?
It was not one single thing. It was the way she faced her illness with honest and remarkable dignity. She was very young, only 32 years old, and she knew that time was becoming limited. So many of our conversations were not about cancer or treatments or even cancer itself. They were about her students, her classroom, and whether she would have enough time to finish the school year. I think that side with me because it reminded me that patients are never defined by their disease alone. Even in the face of advanced cancer, she reminded the teacher, she reminded connected to the people she cared about and to the life she wanted to continue living. And perhaps that question, will I have enough time to finish the school year, capture something profoundly human. It was not really a question about work. It was a question about meaning, purpose, and unfinished life. And I think that is why I have never forgotten her.
It sounds like, from what you're saying, the more we get to know our patients outside of their diagnosis and engage them as we would a friend at a cafe, the more unforgettable they become.
Yes, I think that's very true, of course. We first meet our patients through a diagnosis, through laboratory results, scans, and treatment plans. But over time, if we are fortunate enough, we begin to know the person behind the disease. We learn about their family, their work, their hopes, their fears, and the things that give meaning to their lives. And I think that is when medicine becomes something more than a clinical relationship. It becomes a human relationship, not because we stop being physicians, but because we begin to see the whole person. And once you see that whole person, it becomes much harder to reduce them to diagnosis or a scan result or a line medical record. Those are often the patients we carry with us the longest.
I wonder if I could ask you one more question. What have you learned from the patients in your cemetery whom you visit from time to time?
They have taught me that medicine is important, but it is not always the most important thing. We spent a great deal of time thinking about treatments, protocols, and outcomes. But many patients taught me that what matters most to them is often something very simple: time with family, a meaningful conversation, returning to work, attending a wedding, or in the case of the teacher in the essay, finishing the school year. They also taught me humility, because despite all the advance in oncology, there are still many things we cannot control. And yet, I have seen patients face uncertainty, suffering, and mortality with extraordinary grace and courage. So when I visit that small cemetery in my mind, I don't only remember loss, I remember lessons. And I remember the privilege of having known those patients at all.
Wow. I bet that your patient who is a teacher would have been overjoyed to have heard that you took away from knowing her lessons, and that you honored her by including her in this essay. It has been such a pleasure to have Dr. Hakan Onder, who is a medical oncologist at the University of Health Sciences Antalya Training and Research Hospital in Turkey, to discuss his beautiful essay, The Small Cemetery Within. Hakan, thank you so much for submitting your article and for joining us today.
And thank you very much again. It has been a real pleasure speaking with you. And thank you for thoughtful questions and for the opportunity to discuss the essay. I truly enjoyed our conversation. Thank you very much again.
Thank you so much for writing such a thoughtful essay that really got me thinking about the patients who are in my own cemetery. If you've enjoyed this episode, consider sharing it with a friend or colleague, or leave us a review. Your feedback and support helps us continue to have these important conversations. If you're looking for more episodes and context, follow our show on Apple, Spotify, or wherever you listen, and explore more from ASCO at asco.org/podcasts. Until next time, this has been Mikkael Sekeres for JCO Cancer Stories, The Art of Oncology.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.